Have you ever felt a nagging ache or sharp pain in the back of your heel, especially after a run or first thing in the morning when you get out of bed? That's more than likely your Achilles talking. And if you're over 35 and you still want to run pain-free, this is something you definitely have to pay attention to. Hey there, I'm Dr. Abbey, a physical therapist who helps runners recover from and prevent injuries like Achilles tendinitis. In today's video, we're going to break down what causes Achilles pain in runners, how to actually fix it long term, hint, it's not just stretching, and when it's time to stop pushing through the pain and get actual help from a physical therapist or someone else that knows what they're doing. Stick around because I'm going to share the 3-step framework I use in my clinic and coaching programs to help runners fully recover and get back to pain-free. The Achilles tendon is the thickest and strongest tendon in your body. It's crazy. And it connects your calf muscles, your gastrocnemius and soleus, down into your heel bone, the calcaneus. When it works well, it lets you push off powerfully with each stride during your run. But when it's stressed repeatedly without enough recovery, that's when problems start. There are 2 common types of Achilles issues. Mid-portion tendinopathy, pain that's about 2 to 6 centimeters above the heel, and then there's insertional tendinopathy, pain where the tendon inserts directly into the heel bone. Notice I'm using the words tendinopathy instead of tendinitis. Achilles is not a itis technically, it's a tendinopathy. We can go over what tendinitis is versus tendinopathy another time. What you might notice with both of these, both insertional and mid-portion, is morning stiffness that eases as you move, or when you first get up from sitting for a while, it goes away. Pain during push-off when running, swelling or thickening in the tendon area, not as common, but it could be there. And then in even more advanced cases, pain even when walking after a few steps. So a lot of times people feel pain when they first get up and start walking, but then it goes away after a few steps. If the pain keeps going in more severe cases when you're walking, then that's more advanced and definitely something we need to look at. So what's important to know is this though, Achilles tendon issues don't improve with rest alone. You need active, progressive loading done the right way to truly get healing. Achilles pain rarely happens from one singular event. It's usually, meaning it's not traumatic, it's usually the result of cumulative stress over time. And here are the most common culprits I see in my running clients. 1, sudden changes in training. Maybe you increased your weekly mileage too fast, or jumped into hill sprints or speed work without a proper base built up. Rapid load increases overwhelm the tendon's ability to recover, resulting in a tendinopathy. Number 2, weak or undertrained calf muscles are also Achilles tendinopathy issue. Your calf muscles are supposed to absorb a huge amount of force during running and also produce a huge amount of force during running. If they're weak, the Achilles tendon gets overloaded as it tries to do too much to take up that shock absorption. 3, having limited ankle mobility. If your ankle doesn't bend forward well, meaning dorsiflexion, pulling your toes back towards you, then your heel lifts off early during your stride and that puts more strain on the tendon. 4, overstriding or having poor form during running. Landing too far in front of your body, foot too far in front of your body with a heavy heel strike increases braking forces, stresses the posterior chain, including your Achilles. But heel striking is not bad, and I don't want this to be, you should do a 4-foot strike, you should do a mid-foot strike. This is talking about overstriding resulting in a heel strike. That's putting your foot way out too far in front of you and you're pushing down into it. That not only causes Achilles pain, but other issues as well, and it actually slows you down as a runner. So don't think that this video is about which foot strike is best, because there isn't the best. The worst is just, not the worst, but a bad one is just heel striking when you're overstriding. That's the key there, heel strike when overstriding. Number 5, footwear issues are a huge problem and a huge culprit of Achilles issues. Wearing worn out shoes that don't have the heel toe drop anymore, or transitioning too quickly from a traditional shoe to a more zero drop or minimalist shoe without having proper prep can overload the Achilles because you're putting it more on stretch, you're putting it more on dorsiflexion than what it's used to. Then for runners over 35, there's also one more important factor that we hate to admit, but it does. Recovery takes longer. Tendons get less blood flow as we age, so rebuilding strength and tolerance takes more intentional effort. That's why Achilles issues are so prevalent in the 35 and older and master's age runners. Okay, let's break down the 3-phase recovery plan I use in all my 12-week programs, especially my foot and ankle program, and with my one-on-one clients. Phase 1 is the calm it down phase. The goal is to decrease pain and irritation without completely shutting down movement. My goal is to always keep people running as they can tolerate to a certain extent. So what you're planning on doing during this phase to calm the pain down are isometric calf holds. You're gonna stand on both feet, lift your heels up about halfway, and hold for 15 to 45 seconds, 4 to 5 rounds. Do that 2 to 3 times a day, progressing to the 45 seconds, and then progressing to doing single leg. These help reduce pain and maintain strength without causing more irritation. The number one thing that I want you to do is to avoid stretching the tendon anymore. I know it feels good, it makes it feel better, but it's not helping. A lot of runners try to stretch through the pain, but that compresses an already angry tendon and actually delays healing. Instead of stretching, focus on these isometric heel raises to really start adding stress and strain back to it. For activity modification or for activity and running in this phase, if your pain is over a 4 out of 10 during a run and worse the next morning, then it's time to cut back. That doesn't mean completely rest, it just means some smart adjustments. Decrease the time, decrease the speed, change the surface, things like that. Then an optional thing to do during this phase is adding heel lift inserts or switching shoes to give you a slightly higher heel drop to temporarily unload the tendon. We don't want to do this long term, it's a temporary fix. Phase 2, build things back up, build it back up again. The goal of this phase is to start restoring strength and load tolerance to the tendon and surrounding muscles. In the beginning, we're going to progress those isometrics to moving through a range of motion, and then on to plyometrics for the phase 3. This is the most important phase and the one most runners tend to skip, because once it starts feeling better, they stop doing things. So we're starting with eccentric heel drops. Before we were doing isometric holds, now we're going up on both heels into a heel raise and then lowering down with one leg. Doing this on both sides. You want to do it slowly. You're doing 2 to 3 sets of 15 reps. This loading stimulates your tendon remodeling that we must have to start feeling better. We also want to add in bent knee calf raises. These hit the soleus, that deep calf muscle that handles the bulk of running force when we're running, especially for endurance runners. So then, once we get good at the having pain-free eccentric heel raises, we're gonna start doing single leg heel raises. And then we'll eventually add weight or tempo changes to increase the challenge. Once we're there, remember, we're still doing all of the activity modifications as before, running as tolerated, but following a green light scale, making sure we're not re-irritating and adding too much stress onto the tendon at a time, so that way it actually has the time to heal. Phase 3, return to running fully. Our goal is to rebuild your running form and capacity without triggering any setbacks. So this is at the end of phase 2, and once you can tolerate those single leg heel raise, you're gonna begin basic plyometrics like line hops, skipping, jump rope, pogos. You want the tendon to learn how to store and release injury again safely, which is what we do during running. So, if you've taken time off from running, if you had to take more than a month off, then you're gonna wanna start this phase with a run-walk interval program. 1 minute run, 2 minute walk, and gradually progressing. If you were able to run the whole time that you were progressing through, and with that less than 4 or 3 out of 10 pain during runs, then you wanna start adding and progressing your runs slowly. We don't wanna do too much too soon and result in the same injury or a different injury. But we want to start progressing our runs more while still working on all of our calf strength, all of our plyometric strength, and everything that makes your Achilles nice and happy. Something that you also want to include in this phase are running drills. You want to work on form, doing high knees, butt kips, A skips, B skips, karaoke. All of these can reinforce better loading patterns that also add to that plyometric load. And then definitely want to monitor symptoms after every session, after every run, every strength training, every plyometric drill. Pain that resolves within 24 hours is green light, you're good to go. Pain over 4 out of 10 pain that lingers or worsens, it's time to scale back and reassess again. Keep in mind, recovery isn't linear. Expect good days and bad days and days that feel like setbacks. Tendon healing takes time, and it takes on average 8 to 12 weeks of consistent progressive work. That's not 8 to 12 weeks since you started feeling it. It's 8 to 12 weeks from the time you start working on it. Okay, the big question. When do you stop self-managing and bring in an expert like me? Here are the red flags that I look for. Your pain has lasted more than 3 to 4 weeks without improvement. You can't do 10 single leg heel raises without pain or compensation. These should be slow, 2 seconds up, 2 seconds down. You feel unstable or your running form is just falling apart. You've had multiple flare-ups over the last year. If you're modifying your running but still not improving, the sooner you get help, the faster you'll return to running and with fewer setbacks. So, what do? You get an expert like me, of course. So, if you're tired of guessing and want a proven step-by-step plan to finally fix your Achilles pain, then I want you to grab my 12-week foot and ankle program. You have lifetime access to all updates. It includes everything we talked about today and even more, broken down into bite-sized weekly progressions, walking you through exactly what I would treat most of my Achilles runners with. Or if you want a more personalized approach and to have even more personalized guidance along with some run coaching and other things, apply for one-on-one rehab coaching where I guide you personally and tailor the plan to your specific needs and your training schedule and your pain history, as well as your running goal. Links for both of those are below in this video. Let me know in the comments if Achilles pain has slowed you down. I am here to help. And don't forget to hit that like and subscribe button for more no fluff runner specific injury guidance. I'll see you next time.